Well, welcome everybody. This is our webinar for the National Dental Practice-Based Research Network. And today we will be talking about postoperatory pain. And we have here Dr. Walji, White, and Rindal that will be sharing with us their experience with managing postoperatory pain, and about the POP study, a new study from the National Dental PBRN that if you are a clinician, you're very welcome to join. And we will tell you all about this study, and I hope you will get excited and join us helping develop the science of dental pain. Mohammed Walji is Associate Dean for Technology Service and Informatics and Professor of Diagnostic and Biomedical Science at mHealth Houston in the School of Dentistry there. We also have Joel White, who is a dentist and professor at UCSF, Division of General Dentistry and Division of Biomaterials and Bioengineering. He is also a clinician and does general practice in the faculty group practice at UCSF. And also join us from our National Dental Practice-Based Research Network. We have Brad Rindal. He is the regional director for the Midwest node and senior investigator at Health Partners. He specializes in treating temporomandibular disorders and orofacial pain. We will start with Dr. Walji, and I hope you enjoy.
Great. Thank you very much, Dr. Cruz. It's really a pleasure to be able to speak to you all today. Myself and our colleagues are very interested in using informatics approaches for improving the safety and quality of dental care. And so we were very excited and very fortunate to be able to work with the National Dental PBRN on a study that we've just initiated that seeks to look at measuring post-operative dental pain using technology, and specifically mobile health technology. And this falls very much in line with our initiative to try and improve the quality of care. And as I'm sure many of you know, quality can be thought of in terms of various dimensions. Safety, for instance, the timeliness of care, the effectiveness of care, the efficiency of care, how equitable is the care, and then lastly, how patient-centered is the care. And so we've been going along a journey where we're trying to improve the patient-centeredness of care as well through this study. So I'm going to give you a little bit of a brief background to begin with on the motivations for our study, and then I'm going to turn it over to my colleagues as well to explain a little bit more. So the first concept I want to talk a little bit about is on patient-reported outcomes. And you can kind of see the definition that's been listed there. Patient-reported outcomes are really important and are often not collected systematically, at least, by healthcare providers. But perhaps, the patient's own reports of their own health status, their functions, their symptoms that they're having, are some of the most important ones, although, they may be perceived as being subjective. And so we're really interested in exploring this area of patient-reported outcomes. Now, we're able to really conduct studies like this with the advent of technology, and especially mobile health platforms. I just looked up this morning, what is the penetration rate or what is the adoption rate of cell phones? And I was actually quite pleasantly surprised. According to, Pew Internet, which does these surveys, 97% of all adults in the USA have a cell phone, and 85% of those have a smartphone. So you can see that it's highly prevalent, and I think it's a great opportunity to use to help improve the health of our patients as well. So what we're particularly interested in using mobile health or mHealth platforms, as I'll be referring to collect these patient-reported outcomes. And an example of a patient-reported outcome is the patient's pain experience. So imagine, asking your patients, about their pain, which I'm sure you do, but imagine being able to collect that after they leave your office and being able to monitor that pain and, identify cases where patients may be in a little bit of trouble and may need your help, but also being able to communicate back with them as well. And then lastly, being able to adjust the pain management plan that you have for your patients, after certain dental procedures. So these are really the things that we are hoping to use mobile health technology and patient-reported outcomes for. Now, this all fits in, I mentioned those 6 dimensions of quality, the last one being either patient-centered care or person-centered care here. And again, you can read the definition that's listed there. But it's really being responsive, to the patient's goals, their values, their preferences. And it's really about empowering the patient and coming together in that shared decision-making perspective between you and the patient to help them get better. And so that's what we are really interested and excited about. And I'm particularly interested in this approach for dentistry. So if you take a look at this image, and this was published a while back, but I still think it's very relevant. So if you take a look at this picture, you basically see the patient there kind of at the bottom in this hole of ignorance, as the author has put it. And you've got the healthcare provider at the top, and they're basically looking down at the patient, and they're kind of dispensing their medications or answers to the patient. And so this is kind of that traditional paternalistic model of care, where the patient just does as he or she is told by the healthcare provider. And as we know, that model has definitely changed over the last decade or so. This is the other model, and I think this is a very prevalent model that we have right now. And so this is the idea that, this patient is still in this hole of ignorance that you can see, but, we're throwing down a little bit of a rope to them, and we're trying to push them out of this or pull them out of this hole of ignorance by educating them. And basically still telling them, this is, what they should do and how they should think. And if you look on the bottom right, there's a scale. On the previous slide, the scale was firmly tilted towards the dentist. Now it's a little bit more towards the middle. And I think a lot of our healthcare, including dentistry, is at this level. Then take a look at this level. So this is really interesting, because what do you notice here? Essentially, there is no healthcare provider. And so this was the promise of the World Wide Web and the internet, especially in the early 2000s when it first came about. This was the idea that, without or with the use of technology, patients will be able to manage their own care themselves through, all these discussion groups, etc. But as we know, that hasn't really come to pass. And, oftentimes when patients get out of this hole of ignorance, if it were, many of them are very confused. And you can see that obviously that's not a model that we are purporting either. So lastly, this is the model that I think is what we are trying to strive for, especially us in our research lab when we're really interested in using these informatics approaches. I mean, you can see that this scaffolding or this staircase that's being built, this is an example of technology that we're trying to empower patients with so that they can come out of this hole of ignorance, have a better understanding of their own health, and be able to intelligently talk with their healthcare providers and coming up with shared plans. And so that's really the motivation for the technology component of the study that we are working on. So with that, I'm going to turn it over to my colleague, Dr. Rindal, who's going to give you a little bit of background on the context post-op pain.
So this study helps us better understand the variability in pain experience for the various surgical dental procedures that dentists commonly perform. Some patients don't report any significant pain, and others report significant pain that is usually brought to your attention. They're calling with a complaint. Currently, we have very little data about the pain experience following these procedures. As I said, we become aware when they let us know. We hope they're doing fine, but we really don't know much about their pain experience. Next slide, please. So when we're collecting patient-reported outcomes, this allows dentists the opportunity to better assess the patient's symptoms, their symptom burden, their functional status, potentially pain-related behaviors, and care experiences. Furthermore, emerging healthcare technologies, as Dr. Walji said, such as mobile health applications, can simplify the collection and facilitate that and inform clinical and care, potentially enhance patient engagement, and create a more positive patient experience. This study will be looking at differences in pain experience across these procedures, age, and gender as other factors that may explain some of that variability. Pain is, as we all know, is related to inflammation, which we as clinicians are very well trained to assess. But we must keep in mind that pain is also modulated in the brain, where emotions and pain perceptions come into play. So the clinician's response to the pain, utilizing education and displaying empathy, can also play an important role in the pain experience. Since patients associate pain and dentistry together, it's incumbent on us to continuously improve our pain management for our patients. And this study is designed to do just that, improve our ability to support these patients in pain management. Turn it back to you, Dr. Walji.
Great, thank you very much. So now I want to just quickly talk about the POPS, or the post-operative pain study. So this is a study where we had gone live earlier on this year. I think it was in May. And basically, it is a longitudinal prospective cohort study where we are seeking to gain some insight on the patient's pain experience after certain dental procedures. So, we're looking to recruit around 150 practitioners and about 3,000 patients, across the 6 regions of the National Dental PBRN. And I'll tell you a little bit about our objectives. So our first objective, or our primary objective, is to assess the post-operative pain experiences by dental procedures over a 21-day period, as reported by patients, and also to assess their satisfaction with the pain management. And when we say pain experience, we're looking at the actual intensity of the pain that the patient is reporting, as well as interference of everyday activities, such as being able to sleep. And then obviously we're interested in their satisfaction with the management as well. Our secondary objective is actually to look at the pain management strategies of the dentist. What kind of pain management strategies, what kind of opioid or analgesic medications are being recommended or prescribed. And then what we're also interested in is the actual concordance with the pain management strategy that's recommended by the dentist and what the patient is actually doing. So the great thing with being able to collect data in this way is, we can actually ask the patient, are you taking your medications as prescribed, and how much of it are you taking? So we'll be able to match that up as well. And then lastly, we're very interested in evaluating the technology itself. We feel that this has great utility even outside of the study. And so we're really interested in looking at the perceptions of usefulness and ease of use and actual impact on the clinical workflow to see how it can be targeted well. And so as I mentioned, we're recruiting these practitioners and patients, and there is obviously remuneration available for both. For just as an example, for patients, every time a patient completes a survey, they would get remunerated $5. So now I want to show you a little bit about how it works from the patient side of the things. So here you'll see a video, and I'm just going to pause the video as it goes along. So basically what happens is that on their cell phone, a patient would receive a text message. And essentially, that text message asks them to click a link, So you'll see the text message coming through in a second. And the patient just has to click a link and it goes to this platform. And in this platform, the patient can then easily answer a set of questions. And it's designed to, happen within a minute, 2 minutes maximum. So the patient, let me just go play the video again. They'd get the text message, they'd click the link, they'd answer these sets of questions. And the types of questions we're asking about, what's your level of pain? How intense was the pain after the procedure? What medications are you taking for the pain? We're asking about swelling and bleeding. And then we also ask about pain interference as well, such as, the comfort level of eating various foods, whether they're able to speak, have they had any issues with daily activities, their ability to sleep. And then interestingly, we're asking them about shared decision-making, whether they feel like they've been able to participate in the decision as well as their satisfaction with the pain management. We also ask them about non-medicine methods as well that they may be using to help them relieve the pain. And then lastly, they have a free text comment box that they can complete if they have any questions for the healthcare provider. So the interesting thing about the POP study is we're not doing this just, to collect the data for research purposes. What would happen is once the patient has completed the survey, we will notify the provider or the practitioner about the patient's responses if it goes above a certain threshold. So for instance, and I'll show you the practitioner experience, in this case, the patient has reported some worsening of bleeding and they're, in 7 or 8 out of 10 pain. And so we actually want the dental practitioner to take a look at this case. And so as a practitioner, what you're able to do is you're able to click that message and you're able to get it onto a dashboard where you're able to review all the information that your patient has submitted, and you can actually disposition that case. And the unique thing here is that you can actually chat back to the patient using this feature within the system. Especially if the patient has any questions, you're able to quickly chat back and provide that information to the patient right there. And this can be done either by you, or one of your trained staff as well. And then the patient would receive this message and, they can reply accordingly. Obviously this interface is available on the computer, but it can also be used on a cell phone as well. So now next I want to show you a little bit about from the research side, what are the types of data we're hoping to gather from this? I talked a little bit about our primary and secondary objectives. For various types of dental procedures, we think we're going to be able to characterize over a 21-day period the average amount of pain patients are in. And we're going to be able to slice and dice this information, based on the various patient demographics as well. We also collect pre-procedure pain. And so we're able to have that information and we may be able to adjust and look into that as well. And then the other interesting thing is we're also going to be able to look at the difference between what the provider predicts the pain level to be, because we ask the provider on day 0 or on the day of the treatment, what do they think the patient's pain will be and when do you think it will resolve? And so that will be very interesting finding to see how well or how much concordance it is in. And then on the right-hand side, you see some examples of what we're hoping to see in terms of the types of medications the patient is using, over that 21-day period, and we'll be able to cross it with the pain level as well. So there's lots and lots of different research questions that we're going to be able to ask and answer through this study. And we're really excited. If you guys have any ideas about research questions that you would like to query based on this data, we'd love to hear from you on that. So next, I want to just talk a little bit about where we are with the status of the study. So as I mentioned, we began this study in the full study, I think around May of 2022. And you can see that we are progressing very well. And thanks so much to my colleagues at the National Dental PBRN and all of the regions who are working really hard to recruit everybody, and also to the practitioners and the patients who've agreed to participate. So as I mentioned, our goal for patients is around 3,100 patients. We're about 1/3 of the way there already. So that's really great. That means that, nearly 1,000 patients have used the system over that 21-day period and are contributing data. So that's very positive, because we know that it's very easy for the patients to be able to do that. We have a goal of 150 practitioners. We're about halfway there. And so we're really excited that so many practitioners have agreed to participate, and we're really looking for another 75, 80 practitioners to also participate. Here, we just kind of track here that on the Midwest region and the Southwest region, that's where many of our patients are currently being recruited from, but we're hoping that we're going to see a great increase, especially if we have new practitioners from these other regions signing up. One of the really important things is that we want to get diversity in terms of the patients and providers that we're recruiting. Obviously, we want demographic diversity, but we also want regional diversity as well. And then on the bottom left here, this may be of interest, and I was actually pleasantly surprised by this. So this shows you the response rate of the surveys by patients. So you can see that when patients are sent surveys over this kind of 3-week period, in general, the response rate starts off in the low 80s and it goes to about 70%. So if any of you have been involved in kind of sending out these messages, this is actually a very, very good number. So we're very excited about the patients being able to respond to this. And then we keep a very good eye on patient demographics as well. As I mentioned, it's really important to get a diverse group of patients to participate so that we can really look at if there's any kind of association with a patient's demographic status and the perceived pain level. So we have, patients, we're tracking the ethnicity, we're also tracking the insurance status, as well as the education level and their age demographics as well. So that's kind of where we are currently. We're progressing well, but we're definitely in need of more practitioners and patients so we can successfully complete the study. And with that, I'm going to hand it off to my colleague, Dr. Joel White, our clinician expert, who will tell you more about why you should participate.
Well, thank you, Dr. Walji. I've been involved as a dental scientist in this project for more than 3 years. We found the technology. It was great to do the innovation and set it up so that, and validate it so that this PPRN national study could occur. So I'm really excited to see it moving out nationally because I'm, as a dentist, I use the app and my patients use the app. And the reality is that like this comment here, anything that improves the communication is always received by the patients to be positive. It's all about communicating with the patient, and the app, the platform, is helpful because it's asking questions in a very structured way. And from a science perspective, we get the data, but from a clinician's perspective, these are questions I'm sure we all ask, and they're just put in a way in which the patient answers, and based on the responses, I get alerts. And so from the patient's perspective, they get communication rather than to call the front appointment assistants. The appointment assistants have to then, make a Post-it note and get up and come see me, track me down. This is direct between the patient and the provider. I get the platform, I get alerts, and I get structured data questions so that when I'm ready to speak with the patient, whether I just respond through the platform or actually have to call them, I can tell you most of the time I just respond through the platform, and it informs the patient. So there's benefits to the patient, quicker, easier communication. There's benefits to the provider in that communication is all in one place on the platform. There's a benefit to the practice because all that wasted energy this comment here about reducing the number of postoperative calls. This platform, this follow-app helps to get ahead of the pain, and we get to see what it is that they're doing to alleviate their pain and how it affects their quality of life. So as Dr. Walji spoke, this is a way in which we can empower the patients. They get sent, they get sent the link automatically. They click on it, they're empowered. We then get alerts as providers in the practice. So it's a partnership between us. And some offices have figured out how to do it on their phone. Some offices have figured out how to have their dental assistants, part of their team, address most of them, triage them when there are alerts, and so that is more efficient for the patient, quickly, timely care. So across the board, there's benefits to the patients, there's benefits to the provider and the practice and the team. And then because it's this national study, there's benefits to the profession in getting the data to support how we manage postoperative pain, which is our biggest adverse event in dentistry. The management of pain and postoperative pain is our biggest adverse event. Next slide, please, Dr. Walji. So to participate, it's straightforward. You become a member of the PBRN, and then you can use this QR code. It'll take you to the instructions for signing up for gaining information. Depending on which node or which region you're in and which node, that information goes to the national PBRN. It's distributed to the nodes, and the node coordinators will contact you. And the goal here is that we get a wide group of providers and teams who do painful procedures. They each enroll 30 patients, and the patients and the providers are compensated for using the platform. And our innovation is completed, but I still use the platform whenever I do a potentially painful generating procedure on a patient. So use that QR code. You can take your phone and highlight that and touch it, and it'll pop up with Safari, the link. Some iPhones, you can take a picture of it and still do the same thing to get the information to participate in the postoperative pain study POPs. Next slide, please. So I get the privilege of acknowledging this is a huge effort. It's a multidisciplinary, multi-institutional team. We thank the NIDCR and the National PBRN. This is a grant that's on a national level. It's got a super team behind it, and we would like to invite you to join this team because we don't get to do the science, we don't get to contribute to our understanding of pain and the management of pain without providers and teams like you to enroll in the study. So we'd encourage you to enroll, participate, and I think you'll enjoy the app and the platform and the technology that it brings to your office. And now I turn it back to Dr. Cruz to moderate the questions.
Thank you very much, Dr. White, Dr. Walji, and Dr. Rindal. It was a great presentation, and we are looking forward to the questions from you that attended the seminar today. Just reiterating, contact us if you are interested in joining this study. That's the email there that you can contact us. We are going to put on the chat, if you can see it, the website URL that is connected to that QR code. If you are interested in receiving CE credits, you are going to receive a message, an email from Zoom to complete a short survey. So please do so that we know that you want the CE credits. And also we want some feedback to see how this webinar was for you. So let's go for the first question, and I will read the question, and either Walji, White, or Rindal, you can just join and answer that question. Please, can you show the pain scale the patients use in responding to the question, how much pain do you have now? Asked Dr. Bennett Amaechi.
Yes, we can show the pain scale. Let me just go to the video and show you actually what it would look like from the patient side. So it's a 10-point pain scale, essentially. And Brad, feel free to expand if you'd like.
Yeah, I mean, it's a standard pain scale used throughout disciplines and pain measurement in general. So.
And it goes from no pain to worst imaginable pain, from 0 to 10.
And the
patient, and you'll get an alert at Kim, help us out. I think it's 7 or an 8. A 7 determines an alert, so you would get a red alert on your platform.
Right.
Next question. What about access for practitioner and dental school treating patients? These dental students, Dr. McCalla asked that question.
Right. So I'm in a dental school. I'll answer it from the perspective of the app. If there's something from the study that would refine, then Mohammed or Kim jump in. So we in our previous study, the pilot study before this one, we actually had our AGD residents, which I supervise, loaded in the lab in the app. And so when the patient gets the link, it would come from me as the supervising provider. So the follow app would say from Dr. White. And so the communication would be from the supervising provider, the licensed dentist. I don't think this study supports, and we did not do the dental students managing the pain, because that's like a member of the team. So it's the dentist who's responsible. Did Kim and Mohammed?
Yeah. So I can just jump in there. So in terms of the eligibility criteria, the dentist should be a member of the National Dental PBRN, who's deemed study ready, and then they must be a dentist who performs at least one of the procedure codes, for instance, the endo procedure codes or the perio procedure codes or the oral surgery procedure codes or various implant procedure codes, that they're doing at least one of those per week. So that's kind of our eligibility criteria. So if they're not qualified yet as a dentist, they currently wouldn't be able to participate.
Right, but the supervising faculty, they're doing the work under the license of that faculty. And it would be, if they had problems, they would go to that faculty anyway, post-operative pain-wise. So that practitioner, that dentist who's supervising the faculty as a member of PBRN, meeting the criteria, can enroll and utilize the app.
Thank you. I have a question. What was the intention when you came up with the idea for this study? Why are you doing this study?
Yeah, I can start off, and then Joel, feel free to add on to this. So Joel, Dr. White, my colleague, Dr. Calendarian, and I have been working for several years on trying to determine the types of harm that patients have after dental treatments. And as Dr. White mentioned earlier, post-operative pain just kept coming up, as one of the things that, especially unmanaged post-operative pain or pain that's outside of the normal experience you would expect, just kept coming up. And so this has really motivated us to focus on trying to better characterize that. How much of a problem is this? Who are the types of patients or the procedures where this is particularly problematic? Are there certain management strategies that are working well, that aren't working well? So it's really, based on some of our prior work where this kept bubbling up And then, with the advent of technology, we thought this would be a great way of trying to explore and at least collect the data to begin with. Feel free to add anything, Joel.
Yeah, and the app, the Follow app, was actually started by an oral surgeon who in Europe from London, who ran into this problem and looked at utilizing the technology as a better way to communicate with patients. And so he approached us, we partnered with him and his group, and then we helped to craft using normal dental standards regarding pain assessment and pain management, the app, so that we end up with the structured data. And Dr. Rindal, maybe you want to talk more about the pain questions and the use of anti-inflammatories and antibiotics and opioids, just a little bit, because that might be helpful.
Well, from the perspective of, we, certainly this has become a hot topic. Pain is a common reason patients are exposed to opioids or, antibiotics as well, sometimes to try and manage it. They're having pain, so we prescribe those medications in hopes of helping them. But as we know, we've seen a lot of problems with that. I mean, we have the issues of antibiotic resistance that is now becoming an issue when it's really necessarily appropriate for that situation. And of course, we all know about the opioid crisis, although dentistry is prescribing a lot less of it than it has, but there's still the issue of proper management that is part of this. And the last thing I'll say is that there isn't a lot of good data out there on pain experiences, other than, and so this study does really help to better understand and quantify the pain experience overall. And I think potentially the results of this study could help give your patients a better idea of the potential range of pain experiences they might have, and might help to be a little more preemptive in that, because talking to a patient about potential pain expectations and management up front is oftentimes a good strategy as well, versus recommendations we might make right now. So when you can inform them with more information about the potential range of experiences, I think that is a good way to approach patient care.
So Brad, when dentists participating in this study, are we in the study telling them which medications to prescribe and when to prescribe?
Go ahead, Joel, you got your hand up.
Yeah, that's a great question. And I don't actually know the answer to it. So Mohammed and Kimberly, do they get any of the standards or the general?
No. So in this study, our goal isn't to intervene at all. So in this study, it's an observational study. We're essentially wanting to collect what's actually happening. And that's a great thing with working with the PBRN, or the National Dental PBRN. There's so many practices across the region doing stuff in the real world. And so we really want to collect all of that data. And so we're not being prescriptive. You don't have to prescribe in a certain way. You just continue to practice as you would, essentially. But all we're doing is we're trying to collect that information. So after your treatment, we're going to ask you to fill out a case report form, a quick electronic form, where you say, this is my pain management plan for the patient. And then 3 weeks later, we're going to send you a follow-up saying, did any of that change? So that we can also track that. And then, like I mentioned before, what we're really interested in seeing is comparing what you actually prescribed with what the patient is actually reporting to doing. So are they actually taking the medications more or less, or are they doing something else? So that would be really interesting.
Yeah, Dr. Cruz, there's a couple more questions. Dr. McCullough had a follow-up as saying a dental student would be a AEGD resident. I think, they are in that sense eligible. I think some of the questions might be how that works within the context of that, again, that's the school and the dentist who's in charge of the residents, right? But it is potentially.
Sorry, I didn't mean to confuse. A dental student would be able to participate with a faculty supervising them in a pre-doctoral setting. I just gave as an example the general dentistry residents that I supervise were part of, could be part of. So that's an example. Could be a perio resident, could be an endo resident, and which we did have endo residents as well.
So I would suggest, Dr. McCullough, that you contact us on the national DPBRN at uab.edu, and then our research coordinators here from the South Central region will contact you back and reach out to you, and you can elaborate on the criteria for being able to join the POPs study.
Okay. And Dr. Markman also asked a question there too. I think Dr. Markman, did we answer the question? I believe it was, Dr. Walji, stated that they do what they do. So we're not standardizing any medications because it's not a clinical trial.
Yeah, and I think to be specific, does the app measure any preoperative pain medications? Mohammed, Kim?
So I think we ask if the patient has received any long-acting anesthetic, but not specifically anything beyond that. So.
Correct. And then there's in the link, there's that the patients get plus the providers. There's the post-procedure medications and anything else along during those different time intervals, 1, 3, 5, 7.
Correct.
And it's looking, again, as Dr. Walji said, they at baseline, the provider records what their pain management plan is, including medication prescribing, and then updates it, at the 3-week follow-up. And then we're comparing that to what the patient actually does do as well.
And then Mohammed, I don't know if in any of those videos, if there was a screenshot of like a standard question about the non-steroidals and what those types would be. I think that would be helpful because, clinician wants to see that if you can easily find it. There's the non-steroidals, there's the opioids, there's the antibiotic. There you go. That might be helpful. Right. So depending on the answer, go back right there. So there's your non-steroidals and your opioids and your antibiotics. And then it talks about the frequency and over time.
Okay. Well, now I want to know if I'm interested in participating and I'm not sure if it will work with my practice. I'm busy. I don't have much time to devote for research, but I'm interested in post-op pain. What does it take to participate in this study?
And who are you asking that question of? We've got
Brad, you seem to be willing to answer that.
Sure. Yeah, well, I'll start out, and I know there's other research coordinators here that may want to jump in and add more detail. But to get more detail about what specifically is involved, we would want to talk with you. One of our node coordinators would talk with you, explain a lot more detail. There are things you have to do to be study ready. Because this is a research, you have human subjects training. There are some other related regulatory kind of documents that need to be completed and so on. And then the training typically is done over a lunch hour. They will typically find a time when it works for you, potentially bringing staff. We'll send food as well, so you get free lunch out of the deal, which is always helpful and easy, makes it easier to gather people to understand the study. The training is done over a lunch hour. It's within that hour lunchtime, so we create the training program to fit and give you other resources. Then once you get going, it's doing that first study. I would say, having been a part of studies, doing the first one is like riding the bike. You got to kind of figure out how to operationalize it in your office. The node coordinators are readily available to address your questions, help you with kicking off the study, just anything that operationally you're kind of struggling with. We have a lot of experience. They have a lot of experience doing studies in office settings, and really have, I think, done a very nice job of making these studies feasible to do in a busy clinical practice. So anybody want to add to that?
I'll just add that, we're very fortunate to be able to interview some of our practitioners who have completed the study. I showed you 70 that have gone through. And so, we're wanting to find out from them how it's gone. And generally the feedback has been very good. And as Brad mentioned, once you kind of get through one patient, the rest of the 29 happen very, very quickly. And we've had practitioners complete, I think, within, a month or two at the earliest. So I think it's a relatively straightforward study. Hopefully the technology helps with automating that data collection. We don't try and bombard you. You don't get the patient's survey results every time, only when they meet a certain threshold. You can, of course, if you like, always log in to the system and check their responses if you like, but we're not going to bombard you with email alerts.
Nice. It's very interesting how the dentists are enjoying to be part of this study. What about the patients?
Yeah, and I can answer that. I mean, because we're also interviewing, or we had interviewed when we began this study. We did a short, what we are calling a ramp-up study with, I think up to 50 to 75 patients as well. And we interviewed a portion of those patients just to see how it goes. And I have to say that it's very, very nice to hear their feedback. They love it when a dentist, first they love the communication platform, because obviously they feel like the practice is reaching out to them to see how they are doing. They really appreciate that. And then once they have a question, or if something is outside of the ordinary, once the dentist responds through the chat message, they're delighted. And so I think generally the patients have been very positive about this. And again, we've designed it so it only takes a minute or two of their time. They receive a text message on day 1 after the surgery, day 3, day 5, day 7, day 14, and then day 21. The message goes out at 9 o'clock on their phone. They just click the link, and then they're done, essentially.
Yeah, and at those first critical time frames, there's an 80% hit rate. That the communication, they're using it 80% of the time. That's a success, right?
And I just want to reiterate a comment I made earlier. Patients associate dentistry with pain, and your ability to manage and be sensitive to their pain and responsive to their pain is, again, the responses that Dr. Walji is talking about, I think further reiterate how much patients appreciate that responsiveness and your interest. Just by virtue of collecting the information, you're showing that you're interested in their pain experience.
Right. That doesn't mean that the providers and the team get 80% more alerts. The alerts only come when there's significant swelling, significant pain, bleeding, things that you would want to know as a dentist. So most of them are screened out that don't require an alert.
Well, thank you, Walji.
There's one other question, Joanna, and Dr. Markman has one more question in the Q&A.
Okay, so how can you measure the effectiveness of the management of post-op pain if each participant uses a different criteria for pain management? For example, postoperative management of wisdom teeth extractions can be managed with around-the-clock management of an opioid for 3 days.
I guess I have a few clarifying questions. Because this is observational, we're looking at what the provider does and what the patient's pain experience is. So we're not comparing, this is not a clinical trial. We're not trying to compare effectiveness of different strategies. So we can't answer that question of effectiveness. But we're understanding what's going on, what the patient experiences with that, and how you might look at it and say, how is that compared to someone who manages the extractions with a combination of an NSAID and acetaminophen? Are their experiences any different? But we really can't totally control for other factors because it's not a clinical trial. So I understand your question, but that's not really the primary objective here.
Although you will have that information of what was the procedure done, what was the recommendation of the medication, what the patient took, and what was the outcome. Did they experience fewer pain days or fewer intensity of pain? So we will be able to tangentially answer your question in terms of what's being done, but it's not like Dr. Rindal said, it's not a trial that we are testing the medications. But I think it will be very useful information for pain management in general to be able to report on those and report what dentists are doing.
If you look at the literature, to Dr. Markman's point, if you look at the literature, dentistry as compared to medicine has the highest opioid prescribing pattern of any of the areas in medicine and dentistry. And if you look at the literature, the world I live in, non-steroidal anti-inflammatories are actually better for managing dental pain than opioids. So there's a disconnect there. This study is to gain that information on prescribing patterns. If you think about quality measures, et cetera, other work, we know from our other work that we can identify people who are prescribing or even potentially over prescribing opioids as an example. So this study helps provide that information, but it would take a whole different study to look at prescribing patterns and pain. This is more of a baseline to understand pain and prescribing patterns.
Thank you very much for your questions. Just to reiterate, you can join the study by contacting us, either by using the QR codes that will take you to the websites of the study, or emailing us at nationaldpbrn@uab.edu. Also, you can send your comments and suggestions for future webinars. Thank you very much, the POPs team, for doing the webinar today, and we hope to see you in our next webinar that's coming up in January.